I am Ekta Hinduja and a big warm welcome to my channel. I am bringing a brand new series for you guys and it's called 10 Things to Know with Ekta Hinduja. Today I have a very well-known renowned PedoDontist and her name is Dr. Nithi Daksha. And today I'm going to be discussing about why child's dental care is very important. Thank you so much for taking our time and answering a lot of queries that we as mothers have. So as a mother, it's always a concern for your child in terms of mental health, in terms of physical health, but we as parents always forget their dental health. So when Ayan was born, we were all up and okay with the fact that his milk tooth are coming and it's fine, they'll break eventually. But over a period of time, we realized that he started building cavities. His dental care was taken care of, he was brushing on time, but I don't know, for some reason or the other, he started getting cavities, and that was a big concern for me and my husband Kunal. So then we got to know about a doctor who specializes in a child's dental care, which was a brand new thing for us, and we were like, really, do we have a dentist for children? So they specialize with kids and how they take care of them. So I have Dr. Nithi here.
Thank you, Ekta Hinduja, for having me on the channel. I am grateful that today we're going to talk about so much of information regarding pediatric dentistry that it's going to reach the general crowd, especially the mothers who are unaware of the fact of a pediatric dentist being in the market. So to start with, my name is Dr. Nithi. I am a practicing pediatric dentist across Mumbai and Pune. I have been practicing since past 5 years. I have completed my dental education from D.Y. Patil School of Dentistry. I have been dealing with pedo patients since, as I said, last 5 years.
Lot of parents are always wonder why choose a pediodontist. Why can't they just go to a regular dentist that they have been going through over the years as an adult, like they have been going through? Why specifically invest your money into a pediodontist and just take your child there?
So let me ask you one thing. So when Ayan was 6 months to 1 year old, for a vaccination, would you take Ayan to a general physician or a pediatrician?
A pediatrician.
Why? Because considering the age of your child?
Correct.
So if you are so concerned about his physical health and getting him going to a pediatrician rather than a general physician,
correct,
why not for his dental health go to a pedodontist rather than going to a general dentist?
So Dr. Nithi, speaking of milk teeth, a lot of our older generations and a lot of friends or whatever and whomever I have spoken to, they say कि it's milk tooth, eventually वो टूटने ही वाला है, and why take so much care of them? Because eventually they are not going to stay with us for that long. It will break over a period of time. So then why choose a pediodontist? Why take your child to the doctor?
Okay. So my take on this would be firstly you need to understand that milk teeth are surely going to stay for a shorter period of time in the mouth, but the short period is also a longer period for the child. Because your first milk teeth erupts by the age of 6 months, anywhere between 6 months to 8 months, depends upon child to child. Okay, so and they will start shading off by the age of 8 to 10 years.
Alright.
So right from 6 months to age of 8 to 10 years, it's a longer period for the child because that's the most crucial time when your child is growing. Not just physically, mentally, but overall health of the child is growing. So considering this amount and the duration of the growth, we need to take care of the dental health so much so that the child receives the best nutrition in the body, which will help in the overall development.
So thank you so much firstly for creating awareness about why it's okay not to fall off the milk teeth. They have to take care of that. Now as you become a mother, you make so many parent friends, so many mother friends, and then you eventually become so close to each other. So I floated a Google form across them with the parents that I know, and they had these few questions which they could not find it online or they could not resolve it themselves. So the first question is, how do they take care of the milk teeth that's just started to erupt?
So I would like to answer this way: firstly, the dental care should not be start as soon as the first tooth erupts. It should be starting as soon as the child is born.
Alright.
So, like as soon as the child is born, the first thing the child learns is obviously breastfeeding.
Correct.
Okay. So we need to take care of the gums as well, because once the child starts with the breastfeeding, there is milk residue which remains on the gums.
Alright.
The white residue starts beginning to attach to the teeth once the teeth starts erupting in the mouth.
Okay.
So entirely, slowly, when the residues are not removed from the teeth and the gum, these lead to formation of cavities.
Okay. So how do they clean that gum thing? Like while
So-
the parent is breastfeeding, the mother is breastfeeding, how do they clean that?
Simple protocols need to be followed for oral hygiene. Firstly, you can use a muslin cloth or a normal soft cloth, wrap it around your finger and run it through your child's gums. When you are massaging the child or bathing the child, that is the time when you can do that.
Correct.
That is one thing which is advised on daily basis. And plus, especially after the night feeding, I would advise to run the cloth again in the mouth. The reason why we as Indian mothers, we have this habit that when we are making the child breastfeed, the child tends to sleep while breastfeeding.
Correct. That's true.
So what happens, usually there is pooling of milk in either of the corner of the mouth.
Okay.
So we don't realize that, but this is very harmful. Milk is nothing but lactic acid. So what happens over the period of time, anything in excess is going to be harmful. So if pooling of milk in the mouth, it's going to lead to degradation of the tooth structure and leading to cavities. So what the mothers need to do, I know it's going to disturb the child's sleep.
Correct.
It's going to be little
That's
inconvenient
like
for
one
the
thing we as parents
It's going to
fear.
be little inconvenient for the parents, but it's for the good for the child. So what we need to do after the breastfeeding, once the child dozes off, we need to take a little soft cloth or maybe a muslin cloth, wrap it around the finger and just run it through the gums or the teeth. So once you do that, make your child again sleep, and then the child's oral hygiene is maintained.
Dr. Nithi, in regards with breastfeeding, a lot of friends that I know, they said ki, for how long do you breastfeed and will it spoil the structure of the teeth when you breastfeed them and when you give them a pacifier? Like sometimes we do tend to give them a pacifier. Will that spoil the structure of the teeth?
Breastfeeding is not harmful. There is surely a connection between breastfeeding and dental cavities, but we need to keep in mind that if precautions have been taken, as I explained earlier how you need to take care of the oral hygiene, if you maintain that protocol, breastfeeding should not be a problem. Plus, you need to always be in touch with your pediatrician regarding pediatrician as well as your pediatric dentist, how much and when you need to start weaning off the breastfeeding. So slowly you can cut down on the night breastfeeding so that the pooling of the milk doesn't happen in the mouth, which will not lead to cavities, and daytime breastfeeding is okay. So this needs to be taken care of in consideration with the pediatrician as well as the pedodontist. Reason, obviously your pediatrician is a better person to tell you how much calcium is needed for your child, because lot of times parents correlate, if my child has a lot of cavities, is my child suffering from the deficiency of calcium? It's not the case always. Obviously there might be some or the other ratio issue of the calcium, but whether your child definitely needs a calcium or not, it can be better told by a pediatrician rather than a pedodontist.
So the next question that a parent had was, does the oral care change between the breastfeeding and the bottle feeding?
So the oral care remains the same, more or less the same, but you need to be more careful when your child shifts from breastfeeding to bottle feeding.
Okay.
The reason when you breastfeed your child, you wean it off and then you go for your work.
Correct.
Okay, bottle is something which you give to the child and the child will not leave unless and until you take it from you. So what happens, there is a more chances of milk getting pooled up in the mouth, and which can lead to more cavities. And obviously breast milk being the natural thing, it has a lot of antimicrobial property as well, but which bottled milk doesn't have. So it can be more, child doing bottle feeding can be more prone to cavities as compared to breastfeeding. There is a term which is called as baby bottle syndrome. If you could just Google it, you will understand what is it. It is a term where your child is too much with bottle feeding, has a habit of holding the bottle in the mouth for a longer period of time. Even during the day, there are black spots which appear on the teeth.
Okay.
These are nothing but black spots which are turned into cavities.
Okay.
your child might not complain of any pain or any kind of discomfort with related to this cavity, but slowly it starts degrading your teeth, and that's how the blackness appears on the teeth, which is not good, and eventually it could lead for pain, swelling and discomfort for your child. So you need to be very careful with the oral hygiene when you compare it with breastfeeding and bottle feeding.
Speaking of the black spot you said, I remember when Ayan when he turned 8 months, he already had like 8 tooth already in his mouth, and what we saw was the fact that the front two tooth had a kind of a black spot, though he was not on bottle fed. So when I asked around, the first question they came up was is he on iron or calcium mix? And I was like, yes, he is. And they said, don't worry, over a period of time he's going to be fine, it's just a stain that's left. But it was actually not that. So what do you have to say for that?
So a lot of kids are on multivitamins.
Correct.
because of the environmental thing, how kids have been born and brought up about all the junk food which is available around. Not proper nutrition is received to the kids. So a lot of kids are put upon multivitamins.
Okay.
And all these multivitamins have specifically two contents. One is zinc and one is iron. And zinc and iron have a tendency to leave stains on the teeth. So if you feel that your child has staining on the teeth, firstly get an immediate dental evaluation done from your dentist. Go to a PedoDontist, get it checked. Not always these are stains, they can be cavities as well. So we as dentists have special instruments to check on that and to give you a difference whether it's a stain or it's a cavity. If it's a stain, only cleaning can be helpful for your child, and we remove the stains and your child is good to go home. But if it's cavities, then according to how and the extent of the cavity, a treatment needs to be delivered to your child so that the oral hygiene is maintained.
Then the next question that a parent had was, the child is taking care of the dental care, but still the child is getting cavities.
So that's a very good question, because a lot of parents come to me as well saying that my child doesn't eat too much of sweet.
Correct.
Then why the child
is getting the
cavity? So let me tell you, dental caries or dental cavities is not restricted to one cause. Okay, it's not just restricted because my child eats sweets so he has cavities. It's not just restricted to one cause. It's a multifactorial disease. We term it as like that, multifactorial disease, because dental caries reasoning can be not only because of the child habit, it can be because of all the care which a mother has taken during the child was in the womb.
Okay.
So if you were suffering from any kind of illness or any kind of medical condition or even a fever during your trimester period, so that can also lead to dental cavities in the child. So sometimes dental cavities is also hereditary. All these things are different various causes why a child can get cavities. Sometimes if your child is maintaining the brushing habits too good, but your child doesn't even eat sweet, but still the child has cavities. The third most important question what we ask is, does your child have a habit of keeping food in mouth for a longer time? So what happens when your child has a habit of keeping food in the mouth for a longer time and watching on TV or YouTube and just sucking on the food, not chewing it? So what happens? All the juices of the food which is extracted and being pulled around in the corner of the mouth causes cavity. So because you have to remember one thing, when your child is eating something, the food molecule breaks down and turns into sugar molecule. So ultimately it leads to cavity.
And how often, like for adults it's like once in 6 months, like twice a year we need to visit our dentist. For a child, how often do they need to see the PedoDontist?
A child needs to see a PedoDontist at least 3 to 6 months, in every 3 to 6 months. The reason, firstly your child is growing a lot faster and a lot. So after every 3 to 6 months there can be degenerative changes. Degenerative changes as in changes related to the tooth structure, to the jaw size, to the face, because your child is growing. So all these changes can lead to different analysis every time we look into the child's mouth. So 3 to 6 months is the best time you get your child for a visit.
And when you spoke about the baby care, like would you recommend any toothbrushes like that they come for the, like the baby phase?
Yeah.
Do we have a specific toothbrush for that?
So as I told you, you can use any kind of soft cloth or a muslin cloth. Along with that, you can use finger brushes. Those are excellent for the kids who especially don't cooperate to brush, even if the kid is less than 6 years old. It's not necessary only for a newborn baby. But even
the finger toothbrush
can be used anywhere before 6 years of age. If your child is very stubborn on brushing, where he's not allowing you to brush his teeth with a normal toothbrush, a finger brush can work like wonders. Because you have to put it on your finger, you need to hold your child between your two legs, and you just have to brush it. I know forcing your child for such a good habit or like brushing is not something which we would like. But
you
this
have
is for
no choice.
but we don't have choice because it's for their good.
Correct.
Sometimes you need to be a little more stubborn on that part and need to deliver that for them. So if you could do that, that would be better. There are certain U-shaped toothbrushes which also come.
Okay.
I can share the link. We can post the link on the channel, and that can be useful. So it's a U-shaped toothbrush which comes. You just put it in the mouth. It's a single-handed brush. You just put it in the mouth and you just run across on the left and right side.
And it just
cleans around from all the sides. But obviously it becomes more playful for the kid. So rather than brushing it properly, they tend to keep it in the mouth for a long time. So you need to inculcate certain playful habits for them so that brushing becomes a joyful thing for them.
So like when you spoke about a child visiting to a dentist like 3 to 6 months, does that help getting a braces? Does that avoid the fact कि उनको braces नहीं लग सकते because they are coming to you and then you get to see them? So does that help?
See, nothing can be come in a guarantee pack, but I can tell you one thing: we can definitely prevent. You visiting a dentist or a pedodontist is not something so that things in future can be recorrected from before. But obviously, it can. Suppose if your child is walking into a dentist, already has crowding as in there is no space at all in his milk teeth. So when I look into the patient's mouth, I have a picture of overview that in future, if he doesn't have spacing between his milk teeth, there are chances that he will get crowding in his permanent teeth. Because the permanent teeth are going to be little more bigger in size. The jaw is obviously going to grow, but still there is not going to be adequate space for the milk teeth to fall and the permanent to take their space. So at least I can give you a brief about and I can warn you about situations which can happen with him in future, so that you are mentally prepared of the things which you can take care of. And as soon as the permanent teeth erupts in the mouth, if you feel that your child needs braces, the evaluation can be done as early as possible and treatment can be delivered as early as possible, so that your child doesn't have to wear braces for like 2 long years and have to go to college with the braces. It can be corrected during the schooling age. Yes.
So the next question that a parent had is, I am pregnant and I'm about to deliver. Is there anything I need to know with respect to my child's oral health care?
So dental caries and genetics is linked together. So yes, dental caries cavities can be transferred from the mother to the child. Okay. Because the bacteria which causes dental caries can be transferred from the placenta to the kid. Okay. Other ways, from the other family members, it can be transferred via the horizontal transmission, that is by direct kissing, sharing food. So because jhuta khane se the bacteria can be transferred to the kid, leading to cavities. So this can happen. So you need to be very careful with all these things so that you don't end up transferring your cavities to your child.
That's something like we're so used to hugging and kissing and sharing food, we actually don't realize we are kind of passing on the cavities to them. The next question is, are silver fillings better or tooth colored fillings?
It actually depends upon the affordability of the patient, let me be honest that way. And silver fillings, obviously they are older in the industry and still are being practiced by a lot of dentists, but tooth colored filling is something, a new approach in dental world. So it's better, the more whiter your tooth looks, the more treated it looks like. So that's why whiter fillings are something which parents are looking forward into. So it's like whiter the tooth, they feel more the cleaner the tooth is.
kids who are 2 years plus, how do we take care of their tooth, and what toothpaste and what toothbrushes would you recommend?
Okay, so as initially I said, when the child is somewhere between 6 months to 1 year old, you can practice the oral hygiene measures by using a finger brush or maybe a U-shaped brush, and it should be assisted by the parents. Similarly, as your child grows from when the child becomes 2 years or plus, if your child knows or learns how to spit, then you can start using toothpaste. Okay, and the toothpaste size should be as small as a grain size. Okay, why? Because if you take too much of toothpaste, children don't tend to keep the toothpaste in mouth for the longer time. They tend to spit it out. So if they already spit the toothpaste out and hardly something remains on the teeth, then the brushing will not give you exact good effect as it's supposed to give you. So now a lot of parents even ask me whether what kind of toothpaste should be used.
Correct,
okay?
because in our initial days it was like our parents would give us either one particular brand and they'd be like, since the family is using, even you use the same thing. But now we don't prefer that.
I would not just name a brand. I would just say, as a parent, when you're selecting toothpaste for your kid, may consider a few points in mind. Like the toothpaste should be SLS free. SLS free. SLS is basically, it has amount of sulfate, which has a foaming agent in the toothpaste. Just imagine you being an adult, you take the entire toothpaste put over the brush, and you're trying to brush your teeth. When there is too much of foam coming in your mouth, you tend to spit rather than brushing. Imagine the same thing a child doing. So it's very difficult for a smaller kid with a smaller mouth to take too much of foam in the mouth. And they get the gag reflex very immediately because they don't have a habit of putting too many things in the mouth at the same time. So gag reflex is too much, so they tend to avoid brushing. So make sure you're using an SLS free toothpaste for them. And whether the child should use a fluoride toothpaste or not, that you should ask your pediatric dentist. Why? Because fluoride toothpaste is definitely recommended depending upon the age group of the child. So if your child is 2 years plus and knows how to spit, fluoridated toothpaste should be definitely used at least one time in a brushing. But suppose if your child is suffering from excess of fluoride already, so not additional fluoride is needed. So you need to consult your pediatric dentist before you choose a fluoridated or non-fluoridated toothpaste for your child. So that would be the best thing.
And how about the flossing part?
So the milk or the primary teeth dentition usually is a spaced dentition. Spaced dentition, naturally there are gaps present between your milk teeth. So few percentage of the population don't have this spacing in their teeth. They have tight contacts in their teeth. So with respect to those kids, what you can do, you can use floss to clean the food particle which is stuck in between the teeth. But again, the parents should help the kid to help with the flossing, and not the kid should do it alone, because when the kids tend to floss by themselves, they end up hurting their gums. Because when they try to put the floss in between the teeth, they just try to push it so hard that it ends up hurting the gum and the bleeding of the gum starts. So you need to be very careful, and obviously whether my child should floss or not floss should also be recommended by your pediatric dentist. I would just be very blunt on this. Don't take your decisions just because other kid is been following certain rules for their brushing. You need to, because each and every rules and regulation change and protocol changes from children to children with respect to oral hygiene measures. So you need to visit your pediatric dentist to know what is right for your child.
In terms of how you said every child is different, some enjoy the brushing part and some just run away from the fact that, oh no, it's like the night time again, I have to brush, get up in the morning again, brush, I'm eating something, my mother's making me nervous. How do we encourage the whole system of getting into a good habit of brushing and taking care of their dental care?
Okay. So similar problems, but as a parent you might be even facing while making your child sit for a homework or while making them study. What do you usually do when you do that?
Find something or the other that, it's either you, to be very honest, you tell them, Acha, you do this, I'm going to,
Kind of bribing.
Yeah,
okay, so let's not term it as bribing.
I know it's not right.
No, let's not.
But that actually works.
Okay, so now let's not term it as bribing. Let us term it like a positive reinforcement or a positive reward. What they get once they do their daily course in a well pattern. Okay, so suppose if brushing is made like a daily activity but in a fun way, if your child follows that activity thoroughly and nicely, your child receives a reward. Let the reward not be too big. It can be as small as a star. Let your child collect all the 10 stars continuously by brushing 10 days in a row, by following the routine like morning brushing, evening brushing, and the routine is very well followed for 2 minutes. Upper jaw for 1 minute, lower jaw for 1 minute, and when the child receives all the 10 stars after 10 days, you reward him something big. But make sure that when your child should understand this fact, he's only rewarded when he does something good, and he's not rewarded when he's not doing good. So they should understand the difference, that I only get good things when I do good. If I'm doing something wrong, I'm doing something which is not good, I'm not getting anything out of it. So they should know. They should even know of not a reward when it is not got and a reward when it is gone. So it should be done like that. You can make it little more playful by, you can use a sand timer, because sometimes when you tell your kid, you have to brush for 1 minute. While brushing only, they'll be like, "Ho gaya 1 minute."
That's so common. Like when Ayan is brushing or my nephew is brushing, they're like, "Am I done?"
Am I done? Because they cannot correlate the time. As an adult, we correlate the time easily. So you can correlate the time easily. They can use a sand timer. A standard sand timer is of 1 minute. They can look at the sand timer, throwing up the sand on one end and then flipping it so that they know that the 1 minute is done and now the other 1 minute is done. You can also play their favorite songs, which last for around 1 to 2 minutes. So you know that when the song ends, 2 minutes end. So your child will stop brushing. So there are a lot of brush songs on YouTube which you can actually go through, and you can ask your child to follow that. If not that, you can do one more thing, but I usually don't recommend. Don't start off with a TV channel or something, because if you start off with that, when your concentration is out there, this movement stops, your brushing movement stops. So it should be either some audio or some small timer which they can look into and look forward for. Don't give some big visuals so that the concentration gets diverted.
Thank you so much, Dr. Nithi, for coming to my channel and giving information to the parents in terms of their dental care, which has always been a very less talked about topic. So this is a small gesture from our side. Thank you so much.
Thank you.
And for parents, for grandparents, for people who are taking care of the little ones, I appreciate that you're doing your best. If there's any query, any questions that you have, feel free to check our description box, because we have all the links related to Dr. Nithi there. And Dr. Nithi will be available for the coming week, and she'll be answering all your questions, all your queries, and feel free to do so. Thank you so much for watching. Like and do share this video with all your new parents, your cousins, your friends, because this is very informative. Bye-bye. I have a very renowned doctor with us. She's a PedoDontist and her name is Dr. Nithi
That's it. Nithi Raja Daksha.